Doctor, can you hear us? Hello, doctor, can you hear us?
Can you hear?
Now I can hear. Yes.
Okay. I've switched back to mobile.
Okay.
Can you give me something to put? Just a moment. Hello?
Hello semua, selamat pagi, good morning to everyone, ladies and gentlemen, all my friends and everybody here in FB Live and in Malaysia. My name is Geraldine and that's my sign language name, my sign name. I am representing NESTA, the Negeri Sembilan Association for the Deaf. I want to thank all of you here who are participating in this FB Live. It's about vaccine awareness. And let's find out. I know you all want to know about vaccine awareness. We have here our guest, Dr. Cynthia. And she's from Sungai Buloh Hospital. Thank you, Dr. Cynthia, for being here.
Thank you very much. Thank you very much for having me here. So today we are going to speak a little bit on our vaccine. I have prepared a slideshow which is in Malay. I hope it will be useful for all of you. Okay, so basically we know that in Malaysia, vaccination has been started for every category right now. And I hope all of you have registered. For those of you who have sent a lot of doubts that you have, we will try to answer all your questions. If any of the doubts arise again, you can always reach by probably messaging to Geraldine, or I'll see how I can help you. All right, can we go to the slides? So as we know, today's topic is a little bit on COVID-19 and the vaccination is the main part of it. Next slide. Okay, so why is it called COVID-19? It's because CO stands for corona. It's a crown-like thing. So VI is for virus, and D is for disease, penyakit. 19 is the year that it started. So novel coronavirus, it's a new strain. The next slide. Novel coronavirus is a new strain that has been detected in 2019. That's why it's called as novel coronavirus, nCoV. Okay, next. All right, so a little bit on this history. We had our first case that was the initial part is started in 2019, and first case was 7th of January 2020 in Wuhan, Hubei, China. Just within 3 weeks, we started having cases in many countries. And now the first case in Malaysia was 25th January 2020 until today. So how does COVID-19 spread? One of the main way it spreads is through touch, droplets, nasal droplets. When you cough, when you sneeze, these are the causes. So you can see in the next slide, when one person is infected, next slide, next slide, next. Okay, so when one person is infected and subsequently it infects the rest. Next slide, please. Next, click next, please. Yes, and next, and one more. So you can see from one person, it went to the a family and society and practically the entire nation after that. Yep. So next. So what is the symptoms of COVID-19? Fever, cough, breathing difficulty. And now we also have lethargy, tiredness, sometimes diarrhea, and even nausea. So if you have any of the symptoms worsening, example in the next slide. Next. Yeah. So these are the symptoms. If it worsens, if you have breathing difficulty, chest pain, or your lethargy is worsening, you have to get to the hospital immediately. You can call the clinic kesihatan or our 999 if it's an emergency. So we have five categories of COVID-19 for those who have not known yet. In the next slide, I've shown that. Change the slide. Okay. So stage 1 is the one that you don't have any symptoms. Stage 2, you have some mild symptoms. Stage 3, you have some infection in your lungs. Stage 4, your lung infection worsens, you need an oxygen. And stage 5 is when you are in critical condition. Most of the patients that we saw before this was in stage 1 and 2. Unfortunately, as time goes by, now we have more of stage 4 and 5. All right. So how do we detect coronavirus? How do we know if you are infected with COVID-19? So in the next slide, I've shown you what we call as swab tests. So go on, next slide. Yep. In there, you can see that you take a swab and you'll be put into your nose and your throat. And we have different types of sampling. In the slide, next slide, we can see that you have something called as PCR in the first box, RT-PCR, and also RTK antigen and RTK antibody. Yep. So, so what we do in KKM level right now in Malaysia is PCR and also RTK antigen. All right. RT-PCR detects more accurately, and it takes about 24 to 48 hours for the result to come back. Whereas RTK antigen, the results you may get back immediately. Next slide. So who are the high risk people? Golongan risiko tinggi. So you have warga emas, our old people, kanak-kanak, children, wanita mengandung, pregnant ladies, those with penyakit chronic, those with comorbids like diabetes, hypertension, asthma, and also heart diseases. And also pesakit immunity rendah, which are your HIV patients, cancer patients, this group of people. All right. So next slide. What is the treatment for COVID-19? As per now, there's no specific treatment for COVID-19. You can see in the next slide. Click the next slide. Every treatment that's giving now is to try to reduce the symptoms that the patient has. So how do you avoid COVID-19? So one of the measures in Malaysia, we say 3S and 3W. Do 3S, don't do 3Ws. The 3S would be sesak, elakkan tempat sesak, elakkan sempit, you need to social distance, and jangan sembang dekat. So what you should do, you should wash your hands regularly. In the next slide, wear your face mask properly, and keep warm. If you have any of those symptoms of cough, running nose, or probably you should stay at home and avoid contact with other people. Yep. So next, vaccination, our main topic today. Click the slides 3 times. Next. Okay, so what is vaccine? So basically, vaccine dihasilkan daripada part, okay, I'll tell in English. Vaccine is produced by part of the entire structure of the virus or the virus. The antigen inside the vaccine will try to elicit our immune system. And this will make our body recognize these viruses and fight the disease when it really occurs. So how does this vaccine work? Okay, so when you inject the vaccine, subsequently your body produces an antibody, and that antibody will increase your immunity, and then you'll be able to avoid COVID from coming into your system, into your body. So next, what is the side effect of this vaccine, as we always ask? One of it is pain in the area of injection, some mild fever, lethargy, headache, and joint aches. So after your vaccination, ideally you should rest. If you have any severe infection of this post-vaccination, what do you need to do? So you either call back your vaccination center, your hotlines, or you can go to the nearest clinics And you also should put in into your My Sejahtera, there's a column that says for vaccine adverse reactions or side effects. Report it in there. So, herd immunity. What is called as herd immunity? Immunity kelompok. Next slide. Next slide. So, immunity kelompok means a group of people who are vaccinated in that area can probably cover for those who have not been vaccinated. In the slide, you can see there's two of them who are not vaccinated, probably for certain reasons. Maybe they are not suitable for the vaccination. They have diseases that prevent, they are allergic to certain products of the vaccine compound and they can't be vaccinated. So these are the group of people who cannot be vaccinated. And you see the green ones around it, these are people who are healthy like me and you, who can be vaccinated, who wants to be, and is helping the population by getting the vaccination. So you actually, the green ones will cover up for the red ones so that the disease doesn't affect the red ones. So this vaccination doesn't only depend. This is not only for COVID-19; it's also for all the other vaccines. This is how it works for herd immunity. So currently in Malaysia, we have these vaccines, which are at going now is the Pfizer and AstraZeneca and Sinovac. This slide is a little late, so Sinovac. These are the three that we are having, and we have heard that CanSino is coming in soon. So you can, in the next slide, you can see how the vaccine actually helps when you have a lot of them who have received the vaccine, and only in many of them that received, only one person is probably having the chance of being affected, whereas in the other one that nobody is actually getting the vaccine, everyone gets affected. So who cannot take the vaccine? So those who can't take are those who have allergy reaction history with severe allergy anaphylaxis, which means it's not those allergy that you have to simple like seafood and all that, but you have, if you had severe allergy, swelling, you were since in the hospital, you were admitted. These are the people that should not be taking the vaccine. Or if you're not sure if you actually had history of anaphylaxis, you can always consult your doctor and describe your symptoms. They will tell you whether it's the anaphylaxis or not. Or the second group of people who can't take the vaccine is those with low immune system, those HIV patients with their CD4 count, which is less than 200. And the third group will be those who have a very low platelet count, less than 50K. All right, so who can take the vaccine? Those with diabetes, high cholesterol, hypertension, asthma, G6PD deficiency, those who are doing ongoing dialysis, those who have been taking other vaccines. You can still take the vaccine after 2 weeks of the previous vaccine. Those who are under warfarin, under some medication for blood disorders, and those who don't have severe allergy like I described before. Okay, so we go back to the next slide. You can see further elaboration of what I've said just now. All the people who can take. Ibu mengandung pregnant women can still take the vaccine, Pfizer at this point of time, or those who are actually using IUCD contraceptive, you can still take the vaccine. There's no contraindication to it. Okay. So the next slide, you can see that I put note there, penilaian pra vaksinasi in the third column below, blue color. So this for people who are not sure or you think you have some disease that needs assessment, there will be a clinic that does this assessment. Speak to your own doctors. Okay, so how do you get your vaccination for COVID-19? So you have to download your MySejahtera app. That's the most ideal thing to do. These vaccinations are voluntary basis. You are not forced. It's for your benefit. The vaccine, the type of vaccine that you're going to get is decided by the KKM. You don't have a choice. And the vaccinations are free of charge. There's no charges, even though you take it in stadium or any private clinic. It's free of charge. And you will receive 2 doses of vaccination if you are using the 3 vaccines that are currently available, as I informed. Okay, so your pendaftaran vaksinasi is in your next slide. It's highlighted there how you can register for your COVID-19 vaccination. Next slide. Yeah, so you can see in your MySejahtera app that yellow box there with a needle. That's where you register. Okay. Next. Next slide. So this is again, how do you register in MySejahtera? Why am I emphasizing this again? Because for our deaf community, probably calling the center will not be the most ideal thing to do. I'm not sure if they have deaf-friendly hotlines, but at this point of time, MySejahtera will be very helpful for you. Don't worry, in the end of the slide, I'll give you other options as well. MySejahtera is not your best choice. So this is step by step. How do you register for your vaccination? You can keep this slide. You can probably see it later. If you're not sure or your family is not sure, you can send them this, and this is how you'll register for it. So how do you know if you're getting your vaccine date? Most of them will miss their vaccine date. So in the next slide, I've actually showed you how to set your phone in order for you to be able to get the notification about your vaccination. Okay, so let's go. You're ready, you've registered, you've gotten your date. What do you do to prepare yourself for the vaccination? Next slide. Next slide, please. Back, please. Yep. All right. So what do you do before you go for your vaccination? You've already registered in your MySejahtera. You've activated it. You've answered all the questions in MySejahtera regarding your conditions. You understood and you've signed the vaccination agreement. Then you go to the vaccination area. You bring yourself your IC, your phone with the application of your MySejahtera which you registered in. Wear comfortable clothes. And there, voila, you get your vaccination. For those who need, there will be assistance there. Bring someone if you need help. All right. So what do you do before and after vaccination? So before your vaccination, rest well, eat healthy, get to know all the side effects of the vaccination so that you're prepared mentally. You can prepare your paracetamol, Panadol for normal, simple side effects after your vaccination. Keep hydrated, drink a lot of water, rest if you must, 1 or 2 days. Don't go for any activities, right? And if there's any symptom, get help. Like how I told you, either through updating in your MySejahtera or visit your doctors. So the next slide, I've shown you other ways if you don't have your MySejahtera. What are the other ways that you can register for your vaccination? So you have the first box is your MySejahtera. On your right is your email. It's your website www.vaccinecovid.gov.my. .gov. All right. So that hotline that you have there, I'm not sure if they are friendly, deaf friendly. I shall update once I find out for you. Or you can register in your nearby facility which offers vaccination. And now there's also some mobile vaccination that's going on. Hopefully it reaches you too. If you have problems, what do you do? Next slide. Yeah, so you can see the red box that's highlighted. It's the help desk. So when you click the help desk, you can see that they have a list of questions where you can choose. If your list of questions is not there, you can always put others and key in what your question is. But you can only do all this if you are registered in your MySejahtera for your vaccination. From the latest that we've heard, there's a OKU Central Sime Darby Plantation. Next slide. Next slide. Yep. At this center, they are doing a drive-through for OKU. So they have released in the press actually the statement in some newspaper where this is how you contact them. The phone number is there. The email address is there. If you need help, please contact them. They will help you, especially for the OKUs. So once you have finished your vaccination, next slide. So once you finish your vaccination, this is how your e-certificate will look like, your digital certificate. The yellow one at the end means you've completed both the doses. So next slide. So why are you waiting? Please register yourself and get your vaccination done. Next slide. Okay, so those who have had COVID, please don't be ashamed. Let's not put a stigma on them. We need to curb this disease. Everybody has to play a part. We should do it together. Don't isolate them. In fact, we have to help everyone to get through this disease as human, as a world together. So that's all presentation from me. Thank you. I shall, if there's any questions, I'll get it back to the moderators for them to ask.
We will take a short break. We will take a short break, 5 minutes for toilet or drink break.
Okay,
We'll come back again for more questions and answers with
okay.
Dr. Cynthia. All right? Okay, thank you. Let's take a short break. Okay, we are back.
Okay, can you hear me?
Okay, yes. Hello again, Dr. Cynthia.
Hello, hi.
Our appreciation.
Thank you.
Okay, we like to ask you several questions, and here are the questions. Okay, say a person donates blood. Oh, okay. Say if a person has done his vaccination, can they continue to donate blood if they
Yes,
are a blood donor?
yes, they can. There's a duration of time before they can donate again. But yes, they can donate. It's a temporary time that they can't donate for a while. I think it's about 2 weeks. I'm not sure. It's in Go MOH KKM's vaccine web page. You have that information there. How long after blood donating you can after how long after vaccination you can donate blood?
When I have if I have symptoms like cough or flu and my vaccination is tomorrow, then what do I do?
If your symptoms are severe, see a doctor. And most likely, if you are not fit for the vaccination, you can cancel your vaccination in the app. And you have to give the reason why. And so, if the reason, if it's because of your illness and you are not fit for the vaccination, they will give you another date later. It's in your My Sejahtera Health Desk.
So in the My Sujatra app, it will sort of have the notification there.
Yes. It will show that it will give you an option why you can't attend your vaccination. So you choose the option that you are not well. But do get a doctor to see you first, whether you're fit or not.
Ah, I see. Okay, okay. All right. The third question. See, if you have hypertension and a very high blood pressure, say about 300 or so, is it possible to get vaccinated on that day?
No. If your blood pressure is very high, you will probably put on hold to stabilize your pressure first before you're vaccinated.
Ah, okay, okay. Hmm. My question five, like, oh, okay. If I have a certain allergy and my eyes were swollen, and then sometimes your lips are swollen, what happens? Do we postpone our vaccination?
Yeah, if you have those kind of symptoms, most likely you have some severe allergies. You need to be seen by the vaccine assessment center to see whether whatever that you're allergic to, the particle is not in the vaccination in the vaccine ingredient too. So if you're allergic to any ingredient in the vaccine, that particular vaccine, you can't be given that vaccine. But probably they will see and assess if you can take the other two vaccines that are available right now. The eye swelling and the choking, the breathing difficulty is what we call as the anaphylaxis. Your blood pressure goes down, you probably were admitted in a hospital because of that allergy reaction.
Hmm. Okay. IUD to prevent pregnancies among women.
IUCDs.
Yeah. So it's like every 5 years we sort of changed it, and so it's also convenient for us to have vaccination, no issue.
No problem.
That's great. The other questions that we have, tattooing.
Yes.
Lots of young people, they have tattooing, so they have these tattoos in the body. Again, does vaccination have an impact on the tattoos?
No. No effect. You can go ahead and vaccinate. After your vaccination, give it some time and then you can go and tattoo back again.
Yeah, so no issue at all.
No.
Ah, okay. Drinking of alcohol like beer, or people talk about durian being the king of fruit and it's very heaty. Again, does it all affect when
Okay.
you to get vaccinated?
Technically, there's no food restriction so far for any of these vaccines. But ideally, before you are going for a procedure, you should take care of yourself somewhat, right? So drinking beer, I think is not something ideal. So if you're intoxicated on the vaccine day, we won't know whether you are intoxicated because of yourself or the vaccine. Then it's going to give a false information to the public out there if you are fainting in the middle of the vaccine hall because you are drunk, correct?
Yeah.
So logically, if you have a major event or
Ah,
important
okay.
event in life, you will take care of yourself, right? So
Hmm.
I think drinking and all can wait. It's just a 1 day vaccine thing. I'm sure you can wait for 1 or 2 days before and after.
Yeah, so one has to be patient. Maybe 3 days, give ourselves three
As
days.
many as you can.
Yeah, can.
The
Yeah.
more the
So
better.
then, we can go back to a so-called normal. All right,
Yeah.
my next question. Does BID stands for?
BID is brought in date. Means the patient came in before the patient died before they reached the hospital. before they came into the hospital. Usually, they won't come to the vaccine centers. These will be patients that will be brought to the emergency department.
So it's like emergency kind of arrangements where they go direct to the emergency
Yeah.
area.
Brought in date technically means you had some complication, maybe a heart attack or some asthma attack, a severe asthma attack. Before you could reach the hospital, the patient has already died. So to know the cause of the death of the patient, they will probably need to do a postmortem.
I see. Okay, I understand now. Thank you, doctor. The some okay. When you get vaccinated, for example, okay, like Pfizer, Sinovac, AstraZeneca, and then sometimes they get worried. Does having vaccinated with any of this would allow them to travel out or
Okay,
travel to
so
another
uh,
country?
this vaccine post vaccination traveling to other countries or even in our country depends on the individual government policy. I can't speak on that because it's out of my area of jurisdiction. It depends on the individual government's policy.
Okay, I understand now. Okay, say Pfizer, you have a Pfizer, it's like about 3 weeks for the next dose. And then AstraZeneca is 3 months. Why the difference in the waiting period or the waiting period for your second dose?
The duration of the first dose to second dose is decided by the manufacturer. It's not by KKM. So ideally, Pfizer, they said that you should get your second dose after 21 days. But probably AstraZeneca can go in from 6 weeks to 3 months. So before this, we were actually following that 3 months. It will be revised by KKM, I think. Somewhere between 6 weeks to 3 months, I think should be ideal. It's decided by the manufacturer. The tests, the studies that they do, and they come up with the duration.
Hmm, I see. Okay, for example, like you get vaccinated because you got the notification. So I would go to the vaccination area. Are there choice for me to pick at the vaccination center, or it has already been decided that at this center you have that kind of vaccination?
It's decided actually. So because we are doing mass vaccination, so it's a bit difficult to cater to individual preferences. So our aim is to get a lot of people vaccinated in a short period of time. So the choice of vaccine currently, I think it's not. We don't have a choice for the time being. They might revise it. I'm not sure. But don't
Ah,
worry, your choice of vaccination will depend on your comorbid as well. So if let's say you have allergy to some substance in Pfizer, you would not be given Pfizer, probably an option of other vaccine. There will be doctors who will assess you before the vaccination in the vaccination center.
Wait, I just I was just telling her before vaccination, the doctor will do some form of counseling.
Yep.
So so then so that's where they will know, like after talking to you and just
Yeah.
asking you have, yeah, all the information.
Yes.
So all information are on the My Sejatra app,
Yes.
right?
Yes.
And then
Yes.
you just click.
Yep.
Hmm.
Your
Ah,
comorbids.
okay. The next one, I have low blood pressure. So is it advisable for me to get vaccinated?
Um, when you say low blood pressure, does it mean that generally your blood pressure is on the lowish side, or you are suddenly having a low blood pressure? If you're suddenly having a low blood pressure on the morning of the vaccination, then you should go to the hospital. But if your blood pressure is always on the lower border, you always have your blood pressure which is on the margin, on the lower border, which is normal for you, then vaccination is not a problem.
Okay, understand. Okay. If I'm stricken with cancer, say cancer, the spine, stage 4, how do I still need to get vaccinated? Or and can the can because of my cancer can I get vaccinated and does it work for me?
Okay, so in the case of your cancer patients, we advise you to speak to your oncologist, the doctor that is treating you. So they will advise you whether this vaccination will be beneficial for you and when can you be vaccinated. If you're on treatment, then they'll probably adjust the treatment, or they will advise you when is the best time and what vaccine will be the best. And for those patients with this kind of issues, we will
So that would
actually,
be
sorry.
before before you
Yeah.
get vaccinated, then you go
Before,
and talk to your
yeah,
doctor.
before you even register, talk to your doctor first for this particular case. All right. So as I said, before vaccination is up, they will assess first, and then they will see whether whether it's worth it for you to vaccinate or not. Or otherwise, you are the group of people who will be vaccinated in the hospital, in control centers, in high risk control centers, if you are eligible. If you really can't be vaccinated, then this is where we are playing herd immunity is important, right? I told earlier in the slides, remember? So these are the group of people that we are trying to protect because some of them can't be vaccinated. So the rest of us who can have to go on to vaccination so that we can protect them, those who can't.
Okay. And then, for example, or if I just received a surgery, could be a heart surgery, or it could be, something in my stomach, so I can still get vaccinated.
Yes, you can, but you will have to recover first. The duration of the recovery depends on your individual body. Again, I'm sure after your surgery, you'll be visiting your doctor again. So you can actually talk to them whether you can already apply for the vaccination or not. If you have already applied for the vaccination and you got the appointment date, unfortunately, before the appointment date, you went for a surgery. So you can in the My Sejatra app again, you cancel your appointment, give them the reason that you're going for your surgery. There'll be a place for you to describe what's happening, and then they will probably reschedule you.
Ah, okay. So I can like delay the next dose and so forth.
Yeah, they will advise you accordingly because the delaying of second dose is usually it depends what is the condition. Can't delay it for 1 year, 2 years. So it depends on how long you are delaying it. But if you haven't received the vaccination, even your first dose, and you had some surgery, then yes, we can delay the appointment.
Okay. Um, okay. For mothers who are breastfeeding, for so what's the duration that they can start their vaccination? Like after how many months of breastfeeding? It should be after they've completed breastfeeding, or
No,
uh,
you can, for breastfeeding mothers, you can inject immediately. In fact, there are some studies that shows that the antibody actually goes to the baby through the breast milk. It's not official, but yeah. So breastfeeding mothers are encouraged to vaccinate.
okay. So this is acceptable among mothers who are breastfeeding, right?
Yes, definitely encouraged. Please go and get it.
That's good news. Okay. So for children above 12, can they be vaccinated?
For time being, in our country, is above 18, except for special cases. So this is again government's policy. If they announce the studies being done for younger children, once if it's conclusive, the government will announce if they are vaccinating for children above 12 before 18.
Yeah, so now they're doing it for those who are 18 and above, and they have not worked on vaccinated those who are below,
Yeah,
between
there's
12 to,
there's
yeah.
yeah, there's no mass vaccination for 12 to 18 yet, except for specific cases.
Ah, I understand. Okay. Just, oh, okay. Oh, okay. I saw in the bottles or something, they've got this yellow label, blue label, white label. What is that?
That's actually the name of the brand, the brand of the vaccine. It's just like how you get Coca-Cola, Pepsi. They're all black. They're all carbonated drinks, but it's different brand, right? So just like that.
Okay, wait, yeah. Ah, okay, we got it now. Because many of the deaf people was asking like, "Hey, I got this blue bottle with the blue label or with white label and so forth." Okay. The other one, like, do you think after the first and second dose there will be an add-on of a third dose?
For time being, no. There's probably studies going on in UK. For time being, no. In our country, we are not giving a third dose yet.
Okay. Okay, what if in my Sujatra there are no notification, or I can't just click to say I want a dose of vaccination. There's no way. So what do I do? Do I go and see a doctor or what?
No. Remember in my slides earlier, I hope you'll keep the slides. I've actually shown you how to go to help desk. You go there, you go to the help desk, and then there'll be column for you to fill up, to tick what is your problem. They'll probably be able to address you. Or you can email to the website that I gave you earlier. Remember the website that I told you? Or that if you can get someone to help you from the Deaf Society, if you got someone to help you, you can call the hotline.
But calling the hotline is difficult lah. Somebody else must call lah.
Yeah, I've tried it too, and it took a long time, but they did answer in the end, and I did get my issues resolved in the end. So, try in a not so busy timings. Don't give up. Keep trying.
Hmm. Yeah, I also had a previous, uh, so yeah, I keep trying and trying, and then finally I got it. My email responded, but I couldn't go through the phone line. Yeah.
Yeah, understand. We understand. We hope. I actually by this program that we are doing together with NESDA, it actually awakening that we need another help for those who can't hear. We probably. I hope government will do something about it as well. I'm sure KKM will think of a way to.
Okay. Geraldine wants to ask. Okay, if you have a severe diabetic, or asthma, you have asthma or severe diabetic, and you are taking the inhaler and so forth. So does this group of people, can they be vaccinated as well?
You should be vaccinated first. You should vaccinate immediately. Do not delay your registration. You belong to the high risk group, and you should be vaccinated.
From our comments, there are a number of questions. Just give me a moment for my teamer to read the questions and let us know.
Sure.
Okay. There's one coming up. One of the deaf person who have asked. Okay, for example, I'm in Negeri Sembilan and I moved to Johor, but my Sujatra still has my old number. So what happens? Like if I moved, do I have to come back to JB to get vaccinated?
No, you don't. Remember in your My Sejahtera, there's a column to change your address. Go through my
Update.
slides, you will find a lot of solution there. You can change to your current address.
Hmm. Ah, okay, okay. I understand. Just there's other questions. For example, I got like say fiber, the vaccination for fiber, Pfizer is finished. Uh, but I had my first dose with Pfizer, but because the stock is no longer there, the second dose they change what if Pfizer is not available, will I get another type of a vaccination, a vaccine?
Okay, so this is why actually we have this system to monitor how many doses we are giving, because we don't want to run out of your second dose. If you're given first dose as Pfizer, your second dose will be Pfizer. So hence the meticulous calculation and the control by everyone, I mean by the authorities, to ensure that you have both the doses. So we are calculating, let's say we have 10 people who have taken the first dose, we must ensure that 10 of them will have the second dose of Pfizer.
Mm. Ah, okay, understand. Okay, say for example, like some people we've got this thyroid. Ah, so doesn't regardless of what we have, like if we have thyroid and all that, we can still get vaccinated, right?
Thyroid is not contraindicated for vaccination. You can be
Ah,
vaccinated. It's not contraindication. You can be vaccinated. Can. Boleh.
understand. If a person has contract corona positive, when should they be vaccinated?
Okay, so if you're positive, your vaccination will be postponed. I think a month or 1 to 3 months, they will postpone your vaccination first until you, from the time that you recover.
Ah, so they will be postponed. We're seeing a number of lots of questions.
Sure, no problem.
Okay, okay. Say I have my first dose. Oh, wait. Okay, I say I have my first dose, and then I got pregnant. So will it be okay if I have the second dose, or I have to postpone it?
Okay, depending on how many weeks you're pregnant, likely they will vaccination will be given to those who are 13 to 33 weeks of pregnancy. In special cases, I think they will adjust. Again, report it in my Judra when you cancel the vaccine. Give them the reason why you are canceling the vaccination, so they will know how to adjust your vaccination date for you. Or I'm sure that place that you have went for your vaccination, they will have a hotline. Call them and talk to them about it. Then they will adjust your vaccination date.
Hmm. Okay. Yeah, I take had the second dose, and say now it's all covered by our government. But if they introduce the third dose, then do we have to pay?
For time being, the policy doesn't say so. I'm not sure if the policy will change, but at this point of time, no.
Okay. And if I've already had my second dose, but I still want another dose to support my immunity, is that permissible?
At this point, no, because the study says 2 doses, and our government has approved for 2 doses.
Understand. Okay, let me ask you. Oh, that's been like, it's a lot of questions.
No, no problem. I have the time for you.
Like, if we have the dose, the vaccination, huh? How
Mhm.
long, how long does the vaccination work in our body? Like, is it infinite, whole life kind of guarantee that,
We don't,
you,
sure. We don't know that yet because, as everyone know, COVID is new to you, to us too. So all this is going by studies. So we will know. The answers will be revealed slowly. I'm not sure. We are not sure.
okay. Okay, some of us, some of our friends have said that we are afraid to be vaccinated. So, can we say reject the vaccination, or it's a
Well,
must?
it's not a must, it's voluntary. That's the reason why I've actually allocated my time, my own time, for you to explain, to do this video, to get on live with Nazda, so that you are not afraid anymore. I hope after this slide, after my explanation, you'll actually have the confidence to go and vaccinate and help everyone, help yourself, help your family, help everyone. We have to stop this disease somehow, and together we can do it.
Understand. Okay, this other question. If I've not been vaccinated, can I travel to other countries?
Depending on the other country's policy, their government policy, if they'll allow you to come in or not.
Okay, understand. From all the various countries, different kind of policies.
Yeah.
See, if I'm a stroke patient, I'm bedridden, so can they be vaccinated?
Yes, they should be vaccinated. I'm not sure if there's a facility that they can drive through for the time being, but there are mobile vaccinations. Remember, that's something new that's came up. So I hope there will be access to more of it for this kind of patients. If that patient can actually come to the hospital, stroke is not a contraindication. Again, you should be vaccinated. You are in the high risk too. So do get vaccinated. If you have the facility to go to the center, by all means, please go.
Or bring them? I see. Okay, okay. I'm seeing all these questions coming up
No problem.
on video call.
Yeah.
My. Okay, say if you get vaccinated, right, with Sinovac, can I? There's this question. Can I go to? Okay, if I already got Sinovac vaccination and the country of my destination, uh, recognizes other kind of vaccine. So do I need to get the other type of vaccine?
Then this is again a policy question, a government policy question, which is out of my range to answer. So for time being, there's no option for other vaccinations, and each government recognizes which vaccine. It completely depends on that particular government. We have no say for it. At this point, we are aiming to heal the country from this pandemic. So the main point is to heal everybody first, so that we are devoided of COVID-19 for good. So we can live with COVID-19 like any other viral diseases.
Yeah, so yeah, that's making sure that every citizen has got this,
Yeah,
has got vaccinated
some
regardless
kind
of
of
the brand.
vaccination. Yeah.
Yeah. I understand. Okay, there's this other question. Okay, we heard of this new variant in the corona. So, do we have a new vaccine to counteract it? Like, they've heard the name, the COVID Delta variant, but so do we need to have another type of vaccine for that?
For timing, I don't think so, because they do studies to whether the previous vaccines already cover it or not. So if let's say that improvement needs to be done, I'm sure the manufacturers will look into it. So I think we have to inform our society this, that by getting a vaccination, by any brand vaccination, doesn't mean you will not get COVID. It doesn't mean. Remember, in my slides, I told you there's five categories of COVID, which are five categories of symptoms that you have. Category one being the mildest, where you don't have any treatment, you feel well, you're at home, and the five which are in ICU. So our aim of this vaccination is to try to reduce the morbidity, which means the possibility of you getting COVID category 4 and 5. So even if you get some mild COVID, you probably it will go away without you realizing, or with very mild symptoms. That's our aim of vaccination. So you have to understand, again, I'm emphasizing, by getting vaccination doesn't mean you would not get COVID. You are not immortal to COVID. You can still get it, but hopefully your severity is not so severe and you recover well.
Yeah, so we must continue to take care of ourselves.
Yes. After vaccination, you still have to wear your mask.
Okay. So yeah, continuously to wear our mask. Okay, again now the different brands, Pfizer, Sinovac, AstraZeneca, and so you mentioned earlier that you will have a new one, Moderna or something like that.
Moderna.
Ah, will there be a new vaccine that will be introduced?
I think the government will bring what they think we should have. They will have their reasons why they're bringing in the vaccines. If it's beneficial for the society, for the people of the country, they would likely bring it in.
Hmm. Okay, very clear, doctor. Well, there's some more questions. Okay, there's one question. HIV patients, will they be accepted for vaccination as well?
Yes, remember I in my slide I told you about the CD4 count. If your counts are okay, you're a stable HIV patient under treatment, you will be able to take the vaccination. If you have any doubt at any point of time, don't hesitate to ask back to your treating doctors.
Mm. So before that, the person has to check with the doctor, and then to get the advice from the doctor to be vaccinated or not. If
Yeah.
not, to just stay at home and not to go out.
Yes, you will be the group that the country will protect. That's why we need herd immunity. If you can't take the vaccine, then you belong to the group that you can't take the vaccine for some proper reason. And hence, our society has to help you. So encourage your people around you who can be vaccinated to get it done.
Okay, I want to ask this question. Okay, like if we were to get vaccinated and need to go out and so forth, are there rules to say that you have been vaccinated and you're allowed to come into the like the office or to the other government sectors and so forth?
So far, I've not heard any of those. So do remember, again, I'm emphasizing the entire call for vaccination is not because of rules alone. We have to vaccinate to protect ourselves. So the idea of vaccination, please don't be bound to the just because of rules. I have to do this. No, it's because you want to save your community, you want to save the world, you want to save each other, and that's why you're vaccinating so that we can at least break the cycle of COVID is one measure that we can do to break the cycle. There are other measures that you can do too by isolating and all this, but we have an option to have to be vaccinated. Why not?
I see. Okay. Yeah, that means everybody has to have that responsibility to know to protect themselves and their friends and others.
Yes, Miss Lucy, you're right.
Okay, Geraldine said there are some more questions.
Sure.
What's your advice, doctor, to reduce the number of Malaysians? What's your advice for all Malaysians to reduce the number of those who have COVID?
Okay.
Yeah, about COVID.
All right. So, again, I'm taking this opportunity. Our topic is supposed to be for vaccine, but I'm going to take this opportunity to share a little bit with you. See, the main reason this COVID is spreading because of we don't practice our SOPs, correct? There are circumstances. Every one of us are hypocrites. Every one of us have break the rules somewhere. I believe so. So, but as much as we can, in order to break the pandemic, to break the COVID chain, there must be a stop somewhere, all right? So if you know you are unwell, or you know there are people around you who's unwell, probably, take the precaution matters. Stay at home, wear your mask. And right now, with this MCO, probably do what as the government says, and you can try even at your workplace. You're supposed to be wearing your mask when you come in contact with people and all. So follow the rules. It's very simple, very simple. And if at all, your home isolation, right now we see a lot of COVID spread among the household members. If you are aware of that, no, the whole family gets the COVID and all this. Okay, if you have COVID and you have to isolate at home, ensure that you stay in your room. And if there's a facility of an attached bathroom, then that makes your room ideal for isolation at home. If you are not, then probably speak to the KT or PKD that calls you and asks you, is your house suitable? Be frankful, be frank and be truthful to tell them your health condition, so they can decide whether you can be at home or you should be in the quarantine centers. Quarantine centers are not that bad after all. It's for your own safety, for your family's safety, and also your friends, of course. And last not least, vaccinate.
Just to accept being vaccinated, and this helps in the prevention. Okay, that's
Yeah.
very clear, doctor. Okay, we are less. We have one very last question before we end. Say, for example, I've had my vaccination. Does it interfere with whatever medication I'm taking?
Okay, so again, going back to the slides as well, your answers are there. But though so, if you are taking your stable diabetic hypertension medications, your asthma medication, your thyroid medications, all this has not contraindicated. You can take the vaccination. If you are taking immune suppressors, or you are on chemotherapies, or you have some autoimmune diseases that you are on treatment with steroids, these are the group of people that you should talk to your treating doctor to see whether you are suitable for the vaccination, or you need to have a dose adjustment or time alteration of treatment for you to be able to benefit from the vaccine. So you will come across this words that sounds PVA, pre-vaccination assessment. PVA. Yeah. So they will assess you in this assessment. This can be in your own hospital, or your treating doctor will tell you where to go.
Okay. Uh, she said last, but she skip. She
It's all
she
right.
skip.
It's all right. It's all right.
Oh, this is something that's very comical. Okay, say I'm COVID positive, right? Will it be spreadable to animals like my pet dogs, my cat, and so forth?
Okay. So
What
um,
we think?
we, we we don't have a study on it. I'm not aware of a study on it, but technically we say that if your nasal spread, uh, you have it somewhere on your table and you touch it and you put it into your eye, you might get COVID. So technically, if you have your pets and all and you cough on your cat, you probably can get infected. I'm sure there's a lot of studies going on it, but yeah, it's best when you have your disease. It's best for you to isolate by yourself.
Yeah, so the Geraldine was telling everyone, yeah, stay at home, don't go out to curb the spread.
Yeah.
Yeah, so that was like the last questions.
Sure.
And now, so doctor, any last advice or last statement, last info that you want to share with us?
Sure. So I'm going to take a good 2 minutes to share this. Okay, give me the time. So as we have as a conclusion, this vaccination is important. You guys matter too. All of us, all lives matter. So I was told that the deaf community was thinking that you are not eligible for vaccination. It's not true. You have no issues for not to being vaccinated. If you have a problem with contacting for the vaccination, go through your My Sajatra, go through the websites to get some help, and I'm sure there's organizations which will help you too. Like I think I put up the slide on the OKU email, right? You probably can get in touch of them, and don't be afraid of vaccination. There are some people who cannot be vaccinated. Some will have some kind of allergy reaction, but these are very rare. And there will be control situation where if you have an allergy reaction during the vaccination, there will be doctors there to attend to you. So do not worry. It's very rare. It can happen. I'm not denying, but it's very rare, and it's in control vaccination area. You're not vaccinated in some forest. There will be a team there for you to ensure that this vaccination is safe for you and everyone. All right. So please register. Don't hesitate. If you have any questions that I happen not to answer, you can always get in touch with Geraldine. I'm sure she will text me, but be patient with my reply. I might not reply immediately, but I'll try to help as much as I can.
Yeah, sure. I have the contact, and I will contact you, doctor, if there are our deaf individuals who have some more misguided info or need further
Yeah.
information.
Sure. Go through the slides again. I've done it specially for you over the night, and I hope it really really helps you.
Thank you so much for your help, doctor.
Thanks to you all too.
Okay, then I just want to summarize. We want to thank you, Dr. Cynthia, for these very enlightening dialogue sessions. We also want to thank our sign language interpreters from JUPIM, the Selangor and KL Interpreters and Translators Association, for the deaf community, to all of you. Again, please register with MySejahtera as stated by Doctor. Let's prevent COVID for everyone's safety and for ourselves. We also hope that you will take care of everyone, avoid yourself from getting COVID positive. And thank you, and I love you. Thank you, everyone.
Bye. Thank you.